Assalamualaikum. We are from 4MT. We'll present about health issues related to human nervous system. Okay, let's start.
Hey, Imran, stop playing with that. Stop. Imran, stop. Imran, don't play. Imran, hey, stop.
It's okay. That's the behavior of autism patient. Okay, I'm going to talk about autism spectrum disorder. Spectrum disorder is a mental disorder that includes a range of linked conditions. Autism is abnormality in brain structure or function. This is challenged with social skills, repetitive movement, repetitive behavior, speech, and non-verbal communication. There are a few symptoms of autism patient, which are they will not respond to their name when they were called out. They will do some repetitive movements such as flapping their hands, flicking their fingers, or sometimes rocking their body. They will repeat the same phrases, especially when they watch some cartoon, and they will repeat the same words over and over. Mostly, autism patient will mostly diagnosed when they were toddlers, and it begins before 3 years to show the symptom, but sometimes may not show up until 24 months of life, and this syndrome will last throughout the life. This autism disorder may improve some time with treatment. There are a few treatments that can be done to the patient, which are behavioral management treatment, cognitive behavior treatment, medication treatment, and physical treatment. This treatment is to maximize children's ability to function by reducing autism spectrum disorder, support development, and learning. There are 5 types of autism spectrum disorder, which are autistic disorder, pervasive developmental disorder not otherwise specified, or PPD and OS, Asperger syndrome, childhood disintegrative disorder, Rett syndrome or fragile X syndrome, that is rare gene disorder. This disorder has tendency to run in families because it is a genetic disorder. The inheritance patterns is usually unknown. For the first level of autism, the patient has advanced communication skills, academic abilities, but delayed social skills, severe sensory issues, extreme difficulty with organization skills. In Malaysia, there are 1 out of 625 children were diagnosed as autism spectrum disorder patient, and 25.1% was diagnosed around the world. For the treatment, there are nutritional treatment. The patient can take gluten-free, which is protein in wheat and grain, or even sometimes can take casein-free in dairy products. I think that's all for autism disorder. We can go to the next disorder of brain issue. Thank you.
Moreover, this disease will paralyze the muscle used for breathing. This man will have difficulty in breathing at night. As the conclusion, he will use a device called CPAP, which is continuous positive airway pressure. Last but not least, this man will have difficulty in breathing, talking, eating,
Amyotrophic lateral sclerosis, also known as ALS, is the progressive nervous system that affects the nerve cell in brain and spinal cord. This disease is caused by the motor neuron that fail to function and cause the effector will fail to produce a response. This disease usually begin with muscle twitching, slurred speech, and weakness in limb. Until now, there is no cure for this disease. There are a few symptoms that show the ALS disease, which is difficult in walking, trouble in swallowing, hand weakness and clumsiness, and inappropriate crying, laughing, and yawning.
So this is Shima. She is one of the person who suffers the Parkinson's disease, also known as PD. So the Parkinson's disease is a disease where it slowly damages the central nervous system, which involves the brain and the spine. So it happens when the dopamine in the brain dies, because dopamine is a cell which is a neurotransmitter which is used to send messages between nerve cells. So one of the common symptoms that happens is stiffness, slow movements, and also tremors. So one of the causes is genetic errors, or somebody who worked with pesticides, or maybe she already have a history of head injuries or reduced dopamine production. One of the main symptoms that may happen is poor coordination, slow movement, tremors, or also known as shaking, speech change, and that's it. So thank you.
ADHD, or known as Attention Deficit Hyperactive Disorder. This disease commonly causes by genetics. Symptoms for the disease are short attention span, hyperactivity, impulsivity, fidgeting or restlessness, and disorganization. The patient of ADHD will get bored easily, hard to focus, hard to pay attention, hard to organize and concentrate. Treatment for this disease is medication and therapy. For medication, the patient can take stimulant medication. For therapy, they can do a behavior therapy. For alternative treatment, they need to supplementation with omega-3s, parents training, neurofeedback, and memory training.
Paralysis, or also known as cerebral palsy, is a disease where a person's brain is damaged. So, it could happen before or after a baby is born. It is a condition where there is a failure in muscle and ability of motor neurons to function properly. This could cause a signal to move do not make it through the muscle, and it will result in paralysis. As we can see, the symptoms of brain paralysis patients is stiff muscles, weak muscles, and tremor. They also have a problem with sensation, vision, hearing, swallowing, and speaking. There are many causes of this disease, which is premature birth, not enough blood, oxygen, or other nutrients before or during birth. It will also happen if there is a certain genetic condition that will result in brain paralysis. Because this disease could also possibly occur in children within the age of 3 to 5 years old, there is many ways to improve the child's quality life, which is treatment of physical therapy and speech therapy. But there's one thing you don't have to worry about is this disease will not get worse with age because it is a non-progressive disease. That is all for brain paralysis.
Epilepsy. Epilepsy is a burst of electrical activity in the brain. It is one of the central nervous system disorder. It is an occurrence of an abnormal activity in the brain. This causes the nerve impulses to send an abnormal signs to the brain. Usually, for children, it occurs in the temporal and frontal lobe. For adults, it occurs in the medial or the middle part of the frontal lobe. It can occur in both females and males and any ages of children. This can cause seizures, unusual behaviors, unconscious or muscle spasms, and sometimes loss of awareness. Anyone can develop epilepsy. And there are causes of some epilepsy such as stroke, severe head injury, drug abuse, lack of oxygen during birth, or brain tumor. For seizures, there are also some symptoms that may occur before a seizure. In thoughts and feelings, you may feel scared suddenly or panic. In body, you will feel nausea, feel like you're going to throw up, or you will feel sweaty. In senses, your vision may become blurry or your vision may lose. And other symptoms, you will hear a different or strange sound suddenly. Some people are aware of the symptoms and some are not. For those who are aware, it are called prodrome. This is where you can take early precaution steps to prevent this seizure from happening. Usually, these people will get in safety places or take medication on time. Some will use the rescue treatment that are prescribed for them. Some can recover immediately from seizure, and some will take minutes and hours, or some seizures can lead to death. Epilepsy. There are some symptoms before seizures. One of the symptoms is the muscle in the neck will become stiff. You can barely move your neck. Other symptoms is you may feel panic or feel scared suddenly. And sometimes your vision may lose or becomes blurry. And seizures occur.
Okay, Assalamualaikum and good morning. So today here with me, Michelle, which is one of the person who is suffer from multiple sclerosis. So Michelle, what are the first symptoms that you saw in yourself that made you go and met a doctor?
There was a particular day when people said that my speech was that I speak coherent that people don't understand my speech, and then some people said that suddenly my eyes are blink rapidly, and my mother and father told me that I should go to the doctor to check, and then the doctor checked me, and the doctor said that I was suffered by multiple sclerosis.
Okay, for you to know, multiple sclerosis is an autoimmune disease which is caused when your immune body system is automatically attacks its own tissue, and this will cause a communication problem between neurons. Michelle, what are the way that the doctor use to detect your disease?
The doctor checked me by MRI scanning. The doctor scanned my brain, and that's where he told me that I was suffered by multiple sclerosis.
Okay, for you to know also, this multiple sclerosis have two general factors with it, which is genetic factors and environmental factors. So genetic factors are like you are a female,
Yes.
and also genes encoding. While environmental factors are like infections and vitamin D deficiency. Okay, for your treatment now, what did the doctor ask you to do?
The doctor gave me enough medication to treat my disease, and I also go through physical therapies and rehabilitation therapy.
Okay, I hope your health will be good in a few moments later. Okay, so that's all for now. Thank you.
Alzheimer's disease. Alzheimer's disease is a progressive brain disorder that slowly destroys memory and thinking skill. This disease is named after Dr. Alzheimer noticed changes in the brain tissue. The symptom is trouble with speech or writing, mood and personality change, and memory loss affecting. This patient is usually confused, forgetful, and disoriented even in a familiar place. For example, most people who develop Alzheimer's disease are 65 years of age or older. This disease is currently ranked as the sixth leading cause of death in US. And according to Alzheimer's Disease Foundation Malaysia 2016, it is predicted that currently there are about 50,000 people in Malaysia with this disease. That's all from me. Thank you.
So that's from us. Bye.